Namaste. Myself JB Dr. Priya KPA, Assistant Professor, Department of Panchakarma, JAYOTI VIDYAPEETH Women's University, Jaipur. Today we will deal with some of the specification of Panchakarma theatre and necessary equipments, and also we will deal with koshta and agni importance in case of Panchakarma. Okay, what is importance of agni and koshta pariksha as a prior to Panchakarma procedure. Okay, today we will deal with that. Coming to the theatre, an expert architect should design a good as well as strong building. The building should be very strong, and the building should be built in such a place that which is away from mountains, and it should be big and devoid of dust, smoke, sun, and water. Okay, the room should contain a water tank, kitchen, grinder, pestle, and attached bathroom and toilet, and a separate room for ladies and gents. And the room measurement should be a minimum of 15 into 12 feet. And the room should be spacious so that one can carry out all the activities comfortably. And also ventilation should be there. The room should have enough ventilation and proper light. Okay, coming to the wall and floor, anti-skid floor is having tiles which is having grip, and light colored walls preferably tiled up to 7 feet high, and water outlet facility should be there, and exhaust fan and chimney also should be there. Okay, also water supply, cold and hot water supply should be there separately, and also there should be calm atmosphere, and interior decoration like symbol paintings on the roof and inbuilt cupboards, roof fragrance, coat mat on the floor should be there. Waste disposal, the separate waste disposal system for the solid and liquid should be there. Coming to the essential equipment, the manpower requirement should be qualified Panchakarma physician should be there, trained Panchakarma technician should be there, administrator should be there, housekeeping staff should be there, and a pharmacist should be there. Okay, coming to the things, then droni, the measurement of 9 feet into 2.5 feet size with the extension for performing dhara, and 7 feet into 2.5 feet size without extension for performing dhara should be there. Okay, then fiberglass, it should be of fiberglass or wooden, and it should be movable or fixed, a symbol or decorative, or single piece or double piece. The medicinal wood, that is kupilu with the brass support should be there, and droni stand should be tilting type steel table should be available with lever or handle wheel, and height of stand must be adjustable. These are the things should be seen while taken droni. And for Svedana Karma, steamer chamber should be there. For sitting, 6 feet into 3 feet into 2.5 feet should be there. And for lying, 7 feet into 3 feet should be there. Okay. And there should be a pressure cooker, flexible tube should be there. Then Dhara Patra, flexible stand should be there. Bathtub for Avagaha Sveta should be there. Then Kindi should be there. For Vamana Karma, comfortable chair for relaxing with the hand support, and a vomiting tray and stand with the measuring vessel should be there. And for Virejana Karma, Virejana seat with the collecting calibrated vessel should be there, so that we can see for the Vegas. Okay, how much Vega or bouts we are getting. Then for Basti Karma, Basti Netra, Enma Camp should be there, and Basti Serin should be there for Matra Basti. Then for Nasti Karma, Gokanna, Sputam, Cup, Cotton, Dvimukha Nadi should be there. Then for Jalauka Avajarna, that is for Rekta Mokshana, Jalauka should be there, and it should be well maintained in a tank. And for Pechana, Shayfilaga Patra and insulin needle, etc. should be there. For Siraveda, video session, scalpel blade should be there. Then scalpel needle should be there. Then Alabo, Shringa, sterilization facility should be there. Then flat twine should be there, then kidney tray should be there, and for glove should be there, then Rekta Pravartaga as well as Tambaga Dravya should be there. Okay, and also other equipments like Shirobasi, Putaka, and Shirodhara port should be there. Then LPG cylinder, gas, double burner stove should be there. Then essential medicine and medicated oil. Then emergency medicine should be there. If while, for example, for while doing Svedana Karma and all, there may be a chance of getting burns and all. So Shabdautrata, etc. things should be kept ready before the procedure. Then stainless steel vessel should be there. Then BP apparatus, torch, stethoscope, wash basin, then emergency kit, etc. should be kept ready. Then specification for Panchakarma theatre is then according to Charaka Samhita, in his Sutrasthana 15th chapter, Upakalpaniya Adhyaya, he had mentioned entire setup for a hospital. Okay, first of all, an expert architect should design a good building based on the need. Okay, and the building should be strong and it should not be exposed directly to the wind. Okay. It should be constructed so as to allow the wind only through one passage. Okay, so it should provide comfortable moving place, and the building should not be situated in a mountain area or should not be located near a big building. Okay, besides the building, there should not be too much exposure of smoke, sun, wind, dust, or any undesirable noise should not be there, and it should have some undesirable contacts, taste, sight, smell. These all things should be avoided. Okay, the building should be well equipped with water reservoir, water pot, motor, pestle, then bathroom, latrine, kitchen, and all. And the requirement enumerated above are meant for both the therapy and also any complication in course of administration therapy. As well as management of the patient and afterwards. Okay, so the first aid emergency thing should be get ready before the treatment. And the guidelines are for manpower requirement. There should be Panchakarma physician two, one male and one female, and trained or skilled Panchakarma technician should be there six, three males and three females, and one cash or inquiry department inquiry department. One member should be there, that one either male or female. Then one housekeeping staff should be two males and females. Pharmacist two should be there, either male or female. Okay, space requirement should be there. One consultation room, one reception or waiting hall, and Panchakarma treatment room should be four, two for males and two for females, and medicine preparation should be room should be there one, dispensary room should be one, then storeroom should be there one, bathroom furnished should be two plus two, two for female, two for male. Okay, then after Panchakarma, restroom should be there one at least one, at least two treatment rooms should be attached with the bathroom with the well furnished. Okay, then one multi-purpose treatment table for the administration of Abhyanga, Pindasveda, Nadisveda, Basti, Karma, etc. should be there, and the Shirodhara Yandra should be there along with its port and all. And for Nadi Sweda Yandra, pressure cooker and pipe should be attached, and Shirobasti Yandra should be there, and like leather cap and all. Then Avagaha Sweda Yandra should be there, that is tub. LPG cylinder should be there, stainless steel utensils should be there of 5 liters, 8 liters, and 10 liters, 2 vessel each. Okay, then double burner stove should be there in preparation room, then refrigerator should be there. Okay, the daily supply of fresh medicinal relief for the treatment or as the requirement, the patras like Erana Daragundi, the Tura Karanja, Nimba, etc. should be made available nearby. Then office stationery should be there, a computer should be there, racks, table, then chairs, stool, telephone, posters, etc. should be there. Then essential furniture in every room should be needed, and coat with the button in the restroom too should be there. Then essential BP apparatus, thermometer, measuring glass vessel, weighing machine, case record files. Then wall should be tiled, floor should not be too slippery. So it should the tiles which is having very much grip should be done there. Then massage table, droni, a face steamer, Shirodhara pot, enema can of 1200 ml capacity, then enema syringe of 200 ml capacity, rubber catheter should be there. Then uh, some of the uterine cannula should be there. Then IV drip set should be there, electric heating apparatus for heating thing, other equipments and instrument needed for the Panchakarma should be there. Then supply of water and electricity should be there for 24 into 7 hours. Also essential medicines should be made available for all the time. Okay. And the medicine should be used in the center should be from the reputed companies or with the good quality, and should be labeled properly. Okay, so that we should be able to know the expiry date and all. And how to set up a panchakarma theatre is expectation is a separate panchakarma block should be there, separate room for separate procedure, separate room for campaign procedures, screen partition should be there. Then jewelry decorate, it should be attractive, and exclusive compounds with greeneries and oceans for the site. Then nowadays the reality is that there will be congested, suffocating, greasing, small rooms, and slippery tiles, light colored walls. Water outlet facility should not be proper, exhaust fan and chimney, water supply, everything is not proper nowadays, so care should be taken to avoid all these things. And also the drone should be of fiber or wooden, and it should be moved or fixed. It should be simple or decorated and with a single piece or double piece. And also um, a brass support should be there for that. And and also in annexure, restroom for patient and nurses should be mentioned, storeroom for medicines and utensils should be there, and medicine preparation room should be there. Okay, Masias, the features of Masias should be, he should be qualified, he or she should be qualified, and will should be dedicated, honest, well dressed, apron with apron. It should, they should be well behaved in nature, and hygiene should be maintained. And primary concern is daily cleaning should be there after individual every procedure. Okay, about recycling of oil should be given attention. Then proper sterilization should be done. Then next, coming to the importance of koshta and agni. Okay, there are, we know that there are 13 types of agni present in the body: 5 Odagni, 7 Dhadvagni, and 1 Jadaragni. And among all these 13 types of Agni, Jadrakni is having main important, and it is the digestive fire. And according to Acharya Charaka, the Agni is based upon the two components, based upon assessment is based on two components, that is Abhyavana Shakti and Janana Shakti. If the digestion process, that is Abhyavana Shakti, is proper, then at the end of the digestion there will be Jirna Lakshana. Okay, is produced like Utsaha, Lekhuta, Udkara Shruti, Shud Pravarti, proper Malotsarga. Okay, all these symptoms will be there. And for Koshta Pariksha, the word Koshta and its clinical consideration is having very different meaning. Okay, the koshta may be considered as thoraco-abdominal region anatomically as well as surgically, but koshta may be considered as many of the system on the basis of physiology. But based on the base of the treatment, the koshta is mainly deal with our GIT tract. Hmm? Then Koshta is the Agnisthana. We all know that Acharya Charaga in his Sutra Sthana 13th chapter he told that Grihani Koshtastha Agni Adhishthan Guna Nadi. Okay, Koshta is the Agnisthana, and there are three types of Koshta: Mrudu, Madhyama, and Krura Koshta. And this Koshta is assessed based on the factors like Agni and bowel habit. Okay, in Mritu Koshta, the person is Pitta predominant, and he will pass loose stools and even by taking Kshira. Okay, and in Krura Koshta, what is happening? The water is dominant, the person will be having pass stools. Uh, not regularly, and also has Kadina or Shushka Malapravarti, and requires drastic purgatives to pass stool. For example, Nitra Vrat, etc. So, also in Madhyama Kushta, the person is having Bahusleshma and Dosha are in Samavastha. Okay, and he will pass form the stools daily once and require medium dose for the purgatives and does not purgate on minor laxative or milk. Okay, so it is very important for the assessment of Koshta before going to Virechana Karma or before deciding the dose for Virechana Karma as well as Nehapana. Okay, so for everything the dose will be very different. And coming to the importance of Agni and Koshta, it will help to decide the Dravya Pramana, that is Aushadha Matra and Snehapana Matra. And also it will If the koshta is unknown, then we have to give CSC matra, that is the test dose, according to Ashtanga Hridaya, Sutra Sthana 16 chapter, and to assess the duration of Snehapana. For Mridu Koshta, 3 days of Snehapana, Madhyama Koshta, 5 days of Snehapana, and for Krura Koshta, 7 days is mentioned, up to 7 days is mentioned, and for Vamana, to decide the dose of medicine also it is needed. For Mridu Koshta, according to Vakpata, he told that Alpa Matra, Madhyama Kushta, Madhyama Matra, and Krura Kushta, Pravara Matra should be done. And for, according to Sharamadara, if Koda is given 9 prastha for Mridu Kushta, 6 prastha for Madhyama Kushta, and 3 prastha for Krura Kushta. Why Kasha is in less dose means in Krura Vada is more. Kasha is also Ruksha in nature. Okay. Then according to Sharamadra, Kalka, Avaleha and Chona if we are giving means 3 pala for Mridu 2 pala for Madhyama and 1 pala for Krura And in Virajana to decide the dosage, if it is Kashaya, according to Sharadadara, half pala for Mridu, 1 pala for Madhyama, and 2 pala for Krura And Kalka, Motaka, and Churna, if we are adopting, means 1 Karsha for Mridu 2 Karsha for Madhyama and 1 pala for Krura And according to Vangasena, 1 Karsha for Mridu half pala for Madhyama and 1 pala for Krura and Churna, half Karsha for Mridu, 1 Karsha for Madhyama, and half pala for Krura And if we are giving Swarasa, then all these dose should be of half of the Kashaya. Okay. Then matra of Anupana is Ushna Jala is given as Anupana, as it is explained according to the Koshta by Vangasena. For Mridu Koshta, 1 pala should be given, Madhyama Koshta 2 pala should be given, and for Krura Koshta 3 pala should be given. And for the selection of Aushada and to avoid complication, and for the planning of Samsarjana Krama, the knowledge of Koshta and Agni is very important. Okay, so care should be taken. Only after the assessment of Koshta and Agni, we should give for we should decide the dose of medicine for the treatment. Okay, I hope that you will understand this topic. And if you are having any queries, please do mention in the comment box below. I will try to resolve it. Thank you.